So Hashimoto's and neuropathy is the topic today, the question of the day. Can they be connected? Yeah. So yeah, they can be connected. A fairly decent amount of the time. There's a lot of different types of neuropathy. Okay, right now I think they've lost count. I think they're up to like 100 different causes of neuropathy. But there's small fiber neuropathies, there's mixed fiber neuropathies, and there's large fiber neuropathies. And the small fiber neuropathies are the ones that the Hashimoto's can be involved in. And these are sensory nerves. And you would know that you had small fiber neuropathy by the fact that you would get numbness, tingling, burning, sharp shooting pains. These are the small fibers being irritated by inflammation, by the most common cause of those symptoms, and the most common cause of small fiber neuropathy is prediabetes. But one of the next most common causes of small fiber neuropathy is Hashimoto's, which is autoimmune thyroid disease. And really, it comes from inflammatory responses that create thyroid dysfunction that affects just about everything in your system. But the antibodies apparently can connect with doing damage in your feet. There's a couple of different crosses in this small fiber neuropathy thing. Of those 100 different things that can cause peripheral neuropathy, only about 8 are involved in causing small fiber neuropathy. And again, as I said, insulin resistance, prediabetes, metabolic syndrome, whatever you want to call it, all of those are the most common cause. I would say the second most common cause is probably the immune inflammation. And that immune inflammation can come from Hashimoto's. And then Hashimoto's kind of reacts with gluten. So there's actually something called gluten-sensitive small fiber neuropathy, which is you pray that you have this because you stop eating gluten, your peripheral neuropathy goes away. And it has to do with different mechanisms that ultimately end up creating inflammation to the small fibers in your feet. The nice part about if you have Hashimoto's related small fiber neuropathy, the nice part about that is once you start to pull the triggers and get the immune responses against the Hashimoto's under control, a pretty significant amount of the time, percentage of the time, that small fiber neuropathy will resolve. And so whereas that's not necessarily the case with the other neuropathies that we talked about in the beginning. The mixed fiber neuropathies tend to improve, but maybe not as much, and the large fibers they don't improve at all with most of the things that you would try with diet and nutrition and lifestyle changes. So yep, absolutely. There's so many different vicious cycles. It would take me like an hour to probably go through all the vicious cycles that would make Hashimoto's related to the small fiber neuropathy, because the number one cause is prediabetes. Well, Hashimoto's can contribute to dysfunction in your physiology that can contribute to prediabetes. So it can indirectly be a player in the small fiber neuropathy. So yeah, there can definitely be a relationship there. And it's a relationship that I've seen a lot. I would say I've seen it a lot. Most of the patients who come in with that particular condition don't come in for the neuropathy. They usually come in and have figured, either have like fibromyalgia, or they figured out that they have Hashimoto's, or they think that they have Hashimoto's. And then they have this constellation of symptoms, and usually the small fiber neuropathy is a part of that. In fact, a lot of times they don't even realize it. If it's a fibromyalgia patient, they just feel like they're all hurting all over, and they don't realize that that some of that pain is different. The pain in their feet, the numbness, tingling, burning in their feet, it's actually different from the other pains that are bothering them. So yeah, there's a connection between Hashimoto's and small fiber neuropathy. I don't know. If I had to guess, I don't have those numbers off the top of my head, but I would say probably 20% of the time, 10 to 20% of the time, I would say that there's a connection between that and the neuropathy.